Hello and welcome. My name is Dr. Lisa Campbell, and I am pleased to present this CCA exam review prep series to you. The focus of today's session will provide an introduction to the CCA exam and its requirements. Before we begin, I would like to review my disclaimer with you. First, my sessions are designed to review the concepts that AHIMA has identified that you are expected to know on the CCA exam. Your reviewing my webinars does not guarantee that you're going to pass the CCA exam. It is critical that you learn the concepts, also known as domains, that AHIMA expects you to know. During my reviews, I will provide you with sample questions. These sample questions are not questions that I have taken from the CCA exam, and again, it is critical that you learn the concepts, also known as domains, and avoid focusing on memorizing test questions from any source. For additional information regarding the CCA exam, you'll want to visit www.ahima.org. All right, first things first. No matter which AHIMA exam you are going to take, it is required that you review the candidate guide. The candidate guide can be found on the AHIMA's website on the certification page. This candidate guide covers everything that you will want to know from A to Z regarding your respective exam. Additionally, all AHIMA exams test your ability based on what are known as cognitive levels. Now, you've already heard me mention on several occasions that you must learn the concepts, also known as domains. However, you must also know that the test questions are written to test your ability to recall information, to analyze information, and to apply information. Again, recall, analysis, application. So no matter how you've learned how to code and how you've prepared for the CCA exam, you must recall the concepts that are listed on the domains, and I'm going to talk about those today. Additionally, you must be able to analyze a scenario, recall the concepts, and apply them. Let's take a look at a couple of examples. Where is a topical application of a drug applied? So the first thing that you will need to recall is, what is topical? Okay, and then you know that it's related to the application of a drug. And so by looking at the multiple choice answers, you'll notice that you have head, hand, skin, and mouth. Topical is applied to the skin. It could be applied to the skin of the hand, but the question is very basic in asking you where. And so the best answer would be skin. Let's do another one. An example of a topical application of a drug would be, again, 3 cognitive skills: recall, analysis, and application. So you must know how drugs are applied. So this question is still about topical, but look at your answer choices. Insulin given subcutaneously, nasal spray, pill with enteric coating, or a transdermal patch. Now, in the previous question, you answered skin. So now, because we're still talking about topical, which of the answer choices relates to skin? And if you said transdermal, you are absolutely correct. Let's look at another question. An indigent patient was seen in the physician's office for a urinary tract infection. Which insurance would reimburse the provider? So, one of the things that I want to tell you as you are preparing for your CCA exam, however you learned to code, however you learned all of the different concepts or domains that AHIMA expects you to learn, it's critical that as you're re-reviewing those materials, it's critical that any word that you don't know what it means, it could be medical, it could be English. If you don't know what that word means, it is critical that you look that word up in the dictionary. Also, when you're taking multiple choice questions, you must answer the question. You must understand the question. And in order to understand the question, you must know the concepts. So, which insurance would reimburse the provider? On the CCA exam, you have a domain, which is number 2, called Reimbursement Methodologies. So first, you have to know, number 1, the differences in the payers, and then you must also know what an indigent patient is. So our answer choices are Medicare, Medicaid, Blue Cross, and TRICARE. So the correct answer for this scenario is Medicaid. Medicaid is for individuals that are either medically needy or low income, which is what indigent is. Medicare is for individuals that are 65 or older or disabled. Blue Cross Blue Shield is a commercial payer. And then TRICARE is for your military personnel. All right, so in the coming sessions, we will do some additional questions, but again, I want to overemphasize, you must know the concepts, also known as domains, when you're taking the CCA exam. All right, so let's talk a little bit more about your CCA exam. The CCA exam is a 100 multiple choice question exam that you will have 2 hours to take. So something that is very, 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 very important, you must know the content. You see the theme here? You must know the content to ensure that you can answer these questions in a 2-hour time frame. While you may take a break during the 2-hour time frame, the clock keeps ticking. So your goal should be to take the exam straight through with no breaks. All right, 2 more things and we're going to be done with our first session. On the exam, you will be required to bring 3 coding manuals, okay? Your CPT manual, your ICD-10 CM manual, and your ICD-10 PCS manual. Depending on when you take your exam will determine which year manual you will need. If you are taking your exam from now until April 30th, you will be required to have the 2018 manuals. If you take it after May 1st, 2019, you will then need the 2019 manuals. As a reminder, ensure that you visit the AHIMA website to ensure that you know what's required when you take your exam. All right, the last topic is regarding the domains for the CCA exam. You are expected to know certain domains such as clinical classification systems, reimbursement methodologies, health records, data content, compliance, information technologies, confidentiality, and privacy. In our future sessions, I will focus on each and every domain. Again, this is Dr. Campbell. Thank you so much for listening to my CCA Exam Review Part 1. Bye-bye now.